A beautiful morning it is here. So we finally have got a start date for you. We're going to be opening the offices again as of June 1st. As we've talked about in previous videos, things are going to be very different. We've got very clear directives from our college explaining how we're going to function, and there's a lot of regulations and a lot of new stipulations we have in place. Primarily for your protection and also for our staff's protection as well. Some of which we alluded to before. The first thing you'll do is you'll receive a phone call from our reception staff, and they're going to go through a checklist of questions which we're basically mandated we must do on the phone first. We'll be asking you whether you've been in close contact with anyone with acute respiratory illness, or you've been out of Ontario for the last 14 days. That means out of Ontario as in within Canada, or maybe you're an essential driver, your business takes you across the border. And this is going to continue for a while. So it's important we know that, and basically that will preclude you from treatment for 14 days, and we need you to be truthful on these questions. Secondly, we want to know whether you've been in contact with any confirmed cases of COVID-19, or you yourself have been diagnosed as positive. We'll be checking to see whether you have any symptoms of illness yourself, or for some of our elderly patients, we're going to want to see if they have noticed any sudden changes in their status of health. When you come into the clinic, you will see those questions posted again. And this will be the same whether you're going to see your doctor, your dentist when they finally get to open, or you're going to emergency. This process is for all healthcare situations. So that checklist will again bring this to the forefront. Has anything changed since we called to make the appointment? Again, as you announce your arrival and reception, we'll be checking again to see has there been any change in your status. It's important we do this for a number of reasons. Number one, to protect the subsequent patients that come through the door, and to protect you from coming in contact with someone that's been exposed. Our staff, obviously, it's incredibly important for us. We can't function without our staff, and we desperately have to protect them. As I mentioned before, your appointment times when they're allotted are important. We need you to arrive on time. Please don't come early. Please don't arrive late because we won't be able to see you. It's important that you don't bring people into the office with you unless you desperately need help with getting in and out of the office or in and out of the patient treatment chair, in which case let us know. They also will be screened, and we need to have a contact number for them. So again, in a situation where subsequent infections or ever arise, regardless of the location, everyone can be contacted, everyone can be tracked down, and precautions can be enacted. Initially, for your safety, we're only going to have one practitioner working, so it'll be either Marilyn or myself in the office on the day that you come in. This is not obviously financially a great thing for us, but it's a necessity. It's the only way we can manage to protect your safety given the guidelines we've been issued. So it will reduce the number of treatments we're able to offer at first, but if that's what it has to be, then we're going to comply and make sure we do it properly. So again, you will come in, we'll be screening you again, you'll go straight to your treatment room, you'll receive the treatment that's necessary. Again, we have set times for treatments, so if you end up, for whatever reason, you have a lot of work that we have to do and we're not able to complete it in that allotted time, we may need to get you to come back again. It's just the way things have to be for a while. So again, looking forward to seeing you. The kids are very keen that we get back to work. But please, the masks are a must. There's just at the moment no way we can provide masks for everyone. So please turn up with a mask. If you do need to have someone helping you, make sure they're masked as well. We'll look after you. We'll get you comfortable and moving again much more comfortably. And let's look after each other and get everybody back to normal as quick as we can. Take care.